Extra, extra, read all about it. As you hopefully know by now, we're in the middle of a pandemic. Of the 140 million people who have contracted SARS CoV 19, 33 through 68% of patients have experienced the loss of smell or anosmia. But what causes it? One theory is that similar to the common cold or flu, this is caused by a decrease in airflow through the nasal cavity due to inflammation in the nostrils or excess mucus, resulting in a dulled sense of smell and taste. However, many COVID patients experience anosmia without nasal congestion, so there's other theories. When a COVID particle enters through your nostril, it enters the nasal cavity and is trapped by cilia in the olfactory epithelium. The olfactory epithelium is made up of mature olfactory sensory neurons, OSNs, sustentacular cells, and basal stem cells. OSNs have receptors on their surfaces that odor molecules bind to, and when they do, the OSNs send signals to your brain. They have a short lifespan and are regenerated by the basal stem cells during regular epithelial cycles. Sustentacular cells provide structural support, clear odorant binding proteins after signal transduction in the neuron cilia, and supply these cilia with glucose. Glycoproteins, which contribute to the shape of the COVID molecule, enable it to bind to angiotensin converting enzyme 2, or ACE2 proteins, on the stem and sustentacular cells. This interaction also requires transmembrane protease serine 2, or TMPRSS2. Through these enzymes, the virus is able to enter the stem and sustentacular cells and triggers host responses. Inflammation-related damage may occur to these cells in the olfactory epithelium, including the loss of basal stem cells that regenerate OSNs. Other reactions may include damage to or loss of sustentacular cells, meaning reduced odorant clearing function and indirect effect on OSNs, as sustentacular cells provide structure, support, and protection. Whatever the cause, luckily COVID patients who experienced anosmia are likely to regain their sense of smell within 1 week to 5 months after contracting the virus, because not being able to smell stinks.